So let's talk about WBCs now. WBCs और वाइट ब्लड सेल्स और ल्यूकोसाइट्स. जैसे हमने आरबीसीज में बात की थी कि वहाँ पर न्यूक्लियस प्रेजेंट नहीं होता है, ऑर्गेनेल्स प्रेजेंट नहीं होती हैं, बट हेमोग्लोबिन पिगमेंट वहाँ पे प्रेजेंट होती है. बट इन केस ऑफ WBCs दे लैक हेमोग्लोबिन, बट दे कंटेन न्यूक्लियस एंड दे कंटेन ऑर्गेनेल्स ऑल्सो. अब क्योंकि WBCs में हेमोग्लोबिन पिगमेंट प्रेजेंट नहीं होती है, इसकी वजह से जो WBCs होते हैं दे आर कलरलेस. इसके अलावा WBCs राउंडेड होते हैं, इरेगुलर टाइप के होते हैं, इरेगुलर शेप होती है उनकी, और उस वजह से वो डायपेडिसिस शो करते हैं. एंड नाउ व्हाट इज डायपेडिसिस? सो इट इज दैट कंडीशन इन विच दीज WBCs दे come out of the blood capillaries into the tissues by amoeboid movement. जो भी blood capillaries होती हैं वहां से tissues में आ जाना due to their irregular shape. और जो WBCs का size होता है it is more than RBC. RBCs are little smaller than WBCs. There is an important term that is leukopoiesis. Leukopoiesis is the formation of leukocytes. And sorry मैं आपको बताना भूल गई थी, RBCs के केस में it is erythropoiesis. Erythropoiesis is the formation of RBCs. और वहाँ पर एक और टर्म आती है that is polycythemia. Polycythemia is that condition in which the RBC count is abnormally high. After the introduction area of WBCs, now there is an important terms, types of WBCs. So there are mainly two important types of WBCs. First one is agranulocytes and the second one is granulocytes. Agranulocytes means A से समझ आ रहा है, absence of granules, and granulocytes means presence of granules. ओके जो हमारे ए ग्रेनुलोसाइट्स होते हैं इसमें हमारे टू इंपॉर्टेंट टर्म्स आती हैं, लिम्फोसाइट्स एंड मोनोसाइट्स. और ग्रेनुलोसाइट्स में हमारे थ्री इंपॉर्टेंट टर्म्स आती हैं, न्यूट्रोफिल्स, बेसोफिल्स एंड इयोसिनोफिल्स. Now, if we have to differentiate between the lymphocytes and monocytes, then we can say that this lymphocyte, this lymphocyte has large rounded nucleus. Like if we have to draw the diagram, so this is a lymphocyte, and this one is the nucleus. This one is the cytoplasm. This one is cytoplasm. This one is nucleus, and this one is lymphocyte. And if we have to draw the monocyte, this one is monocyte, and it has bean-shaped nucleus. Okay. And this one is the cytoplasm, nucleus, cytoplasm, and this one is monocyte. Functions की बात करें तो जो monocyte होता है it helps in the formation of spleen and lymph nodes, and lymphocytes helps in the formation of lymph nodes and thymus. Apart from that, monocytes they act as scavengers, and the lymphocytes they helps in the antibody formation. Now after completing the agranulocytes, here comes the granulocytes, which are neutrophils, eosinophils, and basophils. So if we talk about neutrophils, they have multilobe nucleus, and in case of eosinophils they have bilobe nucleus, and in case of basophils they have S-shaped nucleus. If we talk about the leukocyte count of these granulocytes, so neutrophils have the highest total leukocyte count, that is about 60 to 65%, and eosinophils have 2 to 4% of TLC, and basophils have 0.5 to 2% of TLC. Apart from that, neutrophils they have 10 to 12 micrometer diameter, eosinophils have 10 to 15 micrometer diameter, and basophils have 8 to 10 micrometer diameter. Neutrophils they have fine granules present, and eosinophils and basophils they have coarse granules present. Let's talk about the function of granulocytes. Neutrophils का function होता है they are phagocytic in nature, and they engulf germs and dead cells also. Then if you talk about eosinophils function, they are anti-allergic. and also they do the healing of wounds. And in case of basophils, they release heparin and histamine. If we talk about the staining, then neutrophils, they stain with both acidic as well as basic dyes, and it gives pink color. And eosinophils, they give orange color and stain with acidic dyes only, and that acidic dye is eosin. And basophils gives purple color with staining. They stain with basic dyes only, and that is hematoxylin.